The World Health Organization reports COVID cases spiked by 71% around the world last week. CBS's Elizabeth Palmer reports from Bangkok tonight.
In a row, COVID is exploding in northern Europe. France is reporting more than 300,000 new cases a day. And in Britain, hospitals are operating at capacity with admissions rising and some routine treatments postponed. The Omicron variant does appear to cause less serious disease, but COVID is still lethal. And the UK became one of only 7 countries this week to mark 150,000 COVID deaths. By contrast, Asia's COVID deaths remain low, but China's government is on edge. As it puts the finishing touches on facilities for the Winter Olympics next month, an army of healthcare workers is fighting to keep the virus at bay. Heavy-handed tactics include welding shut the doors of anyone suspected of having been exposed to the virus. In spite of invasive monitoring, though, the outbreaks haven't stopped. The latest was in Tianjin, commuting distance from Beijing, where the city's 14 million residents are now being tested en masse after 2 Omicron cases were confirmed. In the northern city of Jian, state TV showed government food deliveries that have kept some of the 13 million citizens going during their lockdown that began on the 23rd of December. China has now rolled out a vast booster program for anyone over the age of 3. Most Western public health officials think its zero COVID policy is unsustainable, but so far there's no sign of China changing course. Elizabeth Palmer, CBS News, Thailand.
For more now on COVID's winter wave, we're joined by CBS News medical contributor Dr. David Agus in Los Angeles. Dr. Agus, want to start with some news that came out of California this weekend, where the state health department said healthcare workers who test positive but are asymptomatic can return back to work. What is that about, and what implications do you think that has for health departments across this country?
Thanks, Jerika. Good evening. What California did actually is say only of last resort. So there's no other option. You have no workers. You could bring back those workers. And if you're COVID positive, you can only care for people who are COVID positive. Certainly, we hope it doesn't get to that situation, but we have to care for people in the hospital. And this is a last-ditch effort to enable them to get the best care, to give them the chance to really get through this.
I want to turn now to a word that's been spreading, flu-rona, this idea that you could have the flu and coronavirus. Is there such a thing?
It sounds like, first of all, a Disney character. But yes, we've seen a handful of cases where people are infected both with influenza virus and COVID-19, the virus, the coronavirus that causes this syndrome. And so it happens. Right now, they are both treatable with the Pfizer pill and Tamiflu-like drugs. We're looking for it in that the PCR test people get now look for multiple different viruses.
And Dr. Agus, in Lilia's piece, we heard that over 5,000 schools closed down in-person learning because of concerns of COVID. What do we need to know moving forward when it comes to keeping children safe and also keeping them in school?
So closing an entire school is a drastic measure. The hope is we don't have to go there often. With testing at least twice a week, we can identify children who are infectious and keep them home and hopefully keep the schools open. The key is going to be testing.
All right, Dr. David Agus, thank you.